A veteran Nollywood actor, come filmmaker Ugezo has urged Nigerians to be guided over the increased trend of relocation to overseas amidst the current economic challenges. Good day, viewers. Welcome back to DDM Hot News Updates on our program, Your Health, Your Wealth. As usual, I often remind you guys to subscribe to our YouTube channel, that is Diaspora Digital Media, popularly known as DDN, to get the latest on health. Guess what is happening today? A veteran Nollywood actor, come filmmaker Ugezo has urged Nigerians to be guided over the increased trend of relocation to overseas amidst the current economic challenges. Well, Niger News reports that the movie star, in a post via his Instagram page on Friday, 23rd May 2025, said a practicing Nigerian medical doctor who relocated to the US has become a meat butcher in the country. Oh my goodness. From doctor to butcher. Ugezo said the medical doctor sold his clinic and relocated to the US. The Tespan said the unnamed medical doctor has become a butcher in a meat shop and is hiding from Nigerians to avoid being noticed. Gosh. While questioning how long he would keep hiding himself, Ugeze urged Nigerians to be guided, adding that many things are not really the way they appear. I support that. The way you look at things might not be the way it is. Look at what he wrote. He said, in the name of Jagba, a practicing medical doctor in Nigeria sold his clinic and relocated to the US. Finally, he is now in the US city. Guess what? He now works as a butcher in a meat shop, hiding from Nigerians to avoid being noticed. For how long? How long will he continue hiding himself? A lot of things are not really what they appear to be. So please, be guided. Next, the National Drug Law Enforcement Agency, NIDO, and the Drug Enforcement Administration of the United States, DEAL, have emphasized the importance of enhancing the existing collaboration between the two organizations in combating the issues of substance abuse and illegal drug trafficking. This was the focal point of the discussions held during a meeting between the Chairman Chief Executive Officer of NIDO, Brig Jane Mohammed Buba Mawa, and the country attaché of USD, Ms. Daphne Morrison, at the agency's national headquarters in Abuja on Friday, May 23rd, 2025. In expressing gratitude to Mawa for the amicable working relationship and partnership between NIDEL and DEAL, Morrison, who has recently been assigned to Nigeria, mentioned that efforts are on the way to arrange additional training for the officers and personnel of the agency's Special Operations Unit, while also anticipating several joint operations with NIDEL in pre-identified areas of interest. She said, I want to make this one of my priorities to come meet with you so we can continue to collaborate and work together. So warming. And I thank you so much for your support over the years, and we are ready to keep things going. Wonderful. I know you have been working well with the last country attaché. So I am ready to get back in and collaborate and do some really great things with you. In his response, the NIDEL boss, in a statement made available to journalists on Friday, 23rd March 2025, through the Director of Media and Advocacy, NIDEL Headquarters Abuja, Femi Babafemi, Mawa acknowledged the excellent relationships with Morrison predecessors. He said, they have been very, very supportive, and I have absolutely no doubt in my mind that it will be the same, if not better, with you. Wow. He noted the recent evolution of NIDEL in the size of its workforce, expansion of operational and administrative structures, as well as remarkable successes recorded in its drug supply reduction and drug demand reduction efforts. Okay. While acknowledging the support received from the deal over the years, especially in areas of equipment, training, and joint operations, Mawa expressed hope that more of such support will continue. I think we would welcome much more support, but because this being your first visit to introduce yourself, I'm not going to bring out a long list of demands or requests, but just to acknowledge that we appreciate all the support we have been receiving, he stated. Up next, the National Emergency Management Agency has launched the 2025 National Preparedness and Response Campaign to mitigate the impact of flooding on communities in Bauchi State. Speaking during the launching of the campaign on Friday, 23rd May 2025, the Deputy Director of General Services, NEMA, Mr. Beatrice Samuel, said Bauchi was one of the states with the highest risks of flooding, hence the sensitization by the agency. Please take note. Bauchi State. If you're part of a Bauchi State, please don't forget to stick this into your head. Yes, if you're not around the Bauchi State, give this news to your loved ones, those who are in Bauchi State, because Bauchi has the highest risk of flooding. Please don't forget. Furthermore, according to him, the campaign by NEMA was a strategic plan for preparedness and response to flooding in Nigeria in response to an early information warning by the Nigerian Meteorological Agency. He said, the information they gave us is very important. So NEMA is being proactive based on that information. Please don't take it for granted. We want to draw out a disaster management implication of those predictions. We will have to call for a national coordination forum where the key stakeholders decided that we take this information to the grassroots. This is why I often tell you, subscribe to our YouTube to get all this sensitive information. What we have come to do here is to sensitize the people and that they are likely to experience flooding in this state as Bauchi is one of the high-risk states in Nigeria. So please take note. That is why we have come here to bring this message for them to take concrete actions using the stakeholders at the state level, using their structures at the local level. Also speaking, he explained that the move was imperative as it equips the communities with better knowledge of how to avert and respond to the disaster, saying disasters are local as they start from the communities. If the community knows what they need to do before the disaster strikes them, they are better prepared. And that is what we have come here to do, he emphasized. Wonderful. Please, the earlier, the better. Stakeholders present at the launch of the campaign include representatives of the Nigerian Army, police, fire services, civil defense corps, and among others. Similarly, the agency took the sensitization to the Mudalawa market as one of the communities previously affected by flood and fire. Please don't allow this to repeat itself. Get prepared. Speaking to the market leaders, Mr. Simon Katu, an official from NEMA, said the agency was in the market to give support to the preparedness that the market people were making this year. He explained that at the end of the engagement, there would be a behavioral change, improvements in response, understanding among stakeholders and communities, so that in the event of disaster, the outcome would be minimal, which is what we want. We want your life to be safe. We want the nation to be better prepared, as disaster preparedness, management, and response are not the work of the government only. Yes, if you continue looking up to the government, you might not come out. So please get prepared first before the government throw in. We are saying that people should come out, volunteer, form community groups that will assist because self-help helps before the government's assistance. Yes, help yourself first. Also speaking, responding to the call, Hajara Wanka, the State Commissioner for Humanitarian Affairs and Disaster Management, said the state government had given the marching orders in ensuring adequate preparation and response in all the disaster-prone communities across the state. Wanka stated, Governor Bala Mohammed has created an enabling environment for partnership and collaboration aimed at improving the lives of Bauchi State citizens. The importance of working together to mitigate the impact of disasters such as floods and fire. She described the meeting as a key step towards building resilient communities, mitigating risks, enhancing preparedness, and ensuring effective response, recovering in the face of flood disasters in Bauchi State. Also speaking, reporting the case that the stakeholders present at the launch of the campaign included representatives of the Nigerian Army, police, fire services, and civil defense corps, among others. Similarly, the agency conducted the sensitization at the busiest Mudalawa market, which is one of the communities that were previously affected by flood and fire. So please, I repeat, if you're in Bauchi, get prepared. The earlier, the better. Up next, medical experts have sensitized over 100 participants to the early signs of pulmonary hypertension at the College of Medicine, University of Lagos, Idi Araba. According to a statement on Wednesday, the experts who harped on early warning signs identified PH, that is pulmonary hypertension, as a serious but often misdiagnosed condition characterized by high blood pressure in the lungs. Organized by the cardiac community in collaboration with the KB Club, the event commemorates World Pulmonary Health Hypertension Day 2025 under the theme, Sometimes It's pH. The experts emphasize the need for early diagnosis, noting that pH symptoms often mimic more familiar conditions like asthma or tuberculosis. A pulmonary hypertension advocate and founder of cardiac community, Ayotunde Omitungu, while sharing her story, urged doctors to look beyond the obvious. She said, our healthcare system is used to seeing only what it knows, that it fails to see what it doesn't. And in that gap, people like me living with a rare disease such as pulmonary hypertension are left behind. A consultant cardiologist at the Lagos University Teaching Hospital, Dr. Oyewole Kushimo, led the discussion on recognizing the signs of PH. He noted that not every case of breathlessness was asthma. Yes. Dr. Tomitope Kwaye for the Department of Hematology and Blood Transfusion at LUTS and a consultant pediatric cardiologist at Lemi Children's Hospital, Abuja, and Dr. Peter Igoche highlighted the link between sickle cell disease and PH in Nigeria. They emphasized that Nigerians bore the highest burden of sickle cell diseases globally, urging the medical community to consider pulmonary hypertension when sickle cell patients present symptoms like breathlessness, fatigue, or persistent cough. Please, experts should take note. When a patient with sickle cell anemia presents symptoms like breathlessness, fatigue, or persistent cough, please check pulmonary hypertension because he or she might be a victim. According to them, Early suspicion can significantly improve diagnosis and better outcome. So the earlier, the better. The KV Club Vice President Ayobami Salu appreciated the speakers and attendees and urged them to pay closer attention to PH, pulmonary hypertension. Don't take it for a joke. Some symptoms might look otherwise, but it might be this particular disease. So please, whenever you see some symptoms like that, don't hesitate to meet a specialist for it. Well, with this, we come to the end of our program on Your Health, Your Wealth. Do ensure to click on the like button, share, comment, and subscribe to our YouTube channel. That is Diaspora Digital Media, popularly known as DDR, to get the latest on health. Until I come your way next, I remain Nigerian Michael Inezini. Thanks for watching. Do have a beautiful day. Bye for now.